lies villages, part of Kamwenge district, where the earth is believed to deliver death rather than rewards. The soils in these villages are sullied with alkaline volcanic rock minerals such as silicon and aluminium, which upon contact with the macrophages, a type of white blood cell that surrounds and kills microorganisms in the human body, into the lymphatic system, which is part of our immune system, yields irreversible rugged swelling of the lower and upper limbs. In worst-case scenarios, among women, breasts too are affected, and sometimes internal organs among both genders. The irreversible swelling, coupled with the exposure to other opportunistic infection, can weaken the immune system and lead to death. But not just that. These same villages are trapped in the vicious cycle of poverty. Soap and other detergents, which are key to the survival of patients suffering from the strain of elephantiasis, are prohibitively expensive.
That was discovered in Kamwenge district, suffering from a strain called podoconiosis. In Kamwenge, the disease is caused by walking barefoot on irritant volcanic soils. It is associated with disability and social stigma. However, simple interventions such as washing the feet within 2 hours of contact with the soil and wearing protective footwear can prevent the disease. However, these interventions were too late for Tanko Batajira, whose struggle began 3 decades ago when she was 28 and pregnant with her second child. Her legs began itching persistently. Elephantiasis patients in Kamwenge district. He's a volunteer though. He says the disease was discovered in 2011 in the district.
We got a number of 30 at first, then later more we got 62. We expect to be having now 1,200.
He explains that there was a community's misconception that these people had been bewitched.
We came to know that it is a disease. We called a joint meeting for district and the community, until the district wrote to the ministry on this case.
He adds that the disease is more common among women and the youth. In the absence of formal aid, many of the victims like Twamsima have resorted to self-medication.
Because they are very weak. Any disease that attacks them, they die anyhow. So, they are advised to use some materials which they can't get because they are very poor. To use the sorot, to use the soap, to use the bandages, to use the jerry cans every time to time, to wash themselves 3 times a day. Comparing it to their income,